The Affordable Care Act, a lot of people are not really sure how it works or what to do to get enrolled. Well, today we are at Coastal Family Health talking to Danielle Davis-Polk, who is the Outreach and Enrollment Coordinator.
Hi.
How are you?
Fine, how are you?
Well, thank you very much for
Thank you.
having us in here today. And the Affordable Care Act, I guess it went into effect last year.
Yes.
And a lot of people were hesitant about enrolling.
Mm-hmm.
So you're going to educate us on the whole system now.
Okay. Well, October 1, the enrollment process began, and what happens is we go into the system. We take persons 2014 or 2013 income tax.
Mm-hmm.
We sit down with them. We do like a one-on-one interview with them. We put the information into the system. Once we get that information into the system, the next thing that occurs is it gives us different plans that they may qualify for. Once that's done, then we're able to show that person or that patient or consumer the information that they qualify for, and at that time they're able to pick a plan. Once they pick a plan, then we take them through the next part of the process, which is paying the payments,
Mm-hmm.
and then helping them understand how the plan works and how they can use that plan at that time.
Now, a lot of people, whenever they came about, they thought they had, they were trying to go online themselves.
Right.
And register for this,
Mm-hmm.
and they were running into all kinds of problems.
Right.
The system wasn't working right, or it was overwhelmed.
Right.
People couldn't do that. But
Right.
now they can actually come to Coastal Family Health and get that done.
They can get that done during the open enrollment process.
Mm-hmm.
They can come and ask questions. If they've had some issues because they tried to do it themselves, we can assist them with that as well. Also, we accept all persons. They do not have to be a patient of Coastal in order to come in and get these services, and these services are free to the public.
Really?
Yes.
So, anybody can come in and get that done.
Yes, anyone.
Yeah, because there are a lot of people that don't have health insurance.
Right.
And or can't, through other carriers, they can't afford health insurance.
Right.
So this has made it more affordable.
It has made it more affordable, and it is dependent on the income.
Right.
That plays a major role in whether or not they're going to get discounts such as a tax credit or a cost sharing subsidy. The tax credit being something that helps them pay their premium monthly. The cost sharing subsidy keeps their copays and their deductible costs low.
Now, can they use this in all areas? I mean, as far as the family's concerned, I mean, in pediatrics or just general practitioner,
They can. It's a company called Ambetter, and it's an HMO policy, so they do have to stay in network, but it's for surgeries, office visits, prescriptions, just like a regular health insurance policy through an employer.
So they don't have to come here to Coastal Family Health to see a doctor?
No.
So
no.
they can go to, well, as you said, if it's a doctor in the HMO system,
Right.
they go see that.
Right, but I will say that Coastal is in network,
Mm-hmm.
and so we do invite persons to use our services because then they won't have to worry about trying to find a provider because we're their provider for them.
Now, do they, let's say they need a surgeon or something like that.
Right.
It covers surgeries, as you said, but they still have to come here, get a referral?
What happens is whoever their doctor is that's in network, if they need to have surgery and they come here to Coastal, then that doctor or either certified nurse practitioner will refer them to a surgeon, which is also known as a specialist.
Right.
And then they can take that insurance as long as they're in network, and then they can go to that specialist, and if the specialist says, well, yes, we need to do surgery, then they'll be admitted into the hospital, and that insurance will cover that. And any other services that need to happen as far as having surgery or whatever services they need to have.
Well, it sounds like you've made it sound a lot easier
It is.
to get covered.
It is.
Now, right now, I believe open enrollment is over
Yes.
for 2014.
Yes.
So what do they do now?
Actually, we ask persons to continue to call us if they have questions because the upcoming enrollment starts in November,
Okay.
November 15th. And so persons still have questions. They're really not sure what to do. And so we can help ease them through that process. We will be educating between now and November to keep everyone abreast of what's going on with the Affordable Care Act so that they'll remember to come to us so that we can assist them through the process.
Okay. Are there any issues that you're running into as far as getting it? I mean, like I said at the beginning, they were having some problems with it.
No.
A lot of those are Or let's just say they got the bugs out?
They got the bugs out. It's a much smoother process. Just depending on the family size determines how long we're going to spend with that person. But it is much smoother. We can get in and pretty much get out and assist that person with some type of health benefits if they meet the qualifications.
So as you said, what you do is they bring in income tax form or
Yes.
whatever, and you go by what their income is as far as what they can afford and different plans?
Right. The criteria is based on the federal poverty level.
Okay.
So if you have a household of one, there's an income amount that they need to meet in order to receive the tax credit as well as the cost sharing subsidy. So we determine that information by looking at their taxes. If they do not file taxes, then there's another route that we take. If we have persons that don't meet that criteria, then we offer coastal services, because here at Coastal, we see persons that do not have health insurance, and we have a sliding fee scale. And then that way, you know, they're not feeling like, well, I couldn't get insurance, so now I don't have anything else to do. They can actually come here and get services as well.
Now, Coastal Family Health, you cover 6 counties.
Yes.
Here in South Mississippi. Can they go to any office for the enrollment program, or do they have to come here to your Division Street office?
They can go to any office. There's an outreach and enrollment assistant available, and wherever they feel most comfortable, whichever is the most closest for them, that's what we want them to do. They just simply pick up the phone and we'll get them an appointment.
Well, it sounds like Coastal Family Health is, you know, I know you've been growing.
Yes.
Yeah, and we've toured the pediatric center, and you know, a lot of people have been wondering about the Affordable Care Act.
Right.
Do I qualify? How do I get into it?
Right.
And again, want to remind you that open enrollment will reopen November 15th of
Yes.
2014. So keep that in mind. And of course, if you have any other questions, that you can definitely call and find out. Anything else that you want to mention about it?
No, we just want persons to come in so we can assist them. The process seems like it's difficult, but if you have that person that can really help you through the process, you're going to feel more comfortable. And you won't feel like you don't know what you're doing, or you're doing something.
Yeah, because I'm
wrong.
sure if you're sitting there with a computer or something, or somewhere by yourself, or wherever trying to enroll, it might get a little confusing.
Right.
And you know, a little aggravating.
A lot of aggravation.
A lot of Well, thank you so much, Danielle, for educating us on this, because I know there are a lot of people that are wondering about that, wondering if they qualify for the Affordable Care Act. So there you go. If you have any questions, you can call Danielle here,
Yes.
or any of the locations of Coastal Family Health. They'll be glad to help you out. And again, we'll remind you that open enrollment again opens up November 15th
Yes.
of this year. So if you need some help, give them a call here at Coastal Family Health.